make sure you go out and you have your cup of Lipton tea this morning to get you going. Okay, so we're talking about head and neck cancers. Now, is a subject I know very little about, but the information I have here is if your alcohol consumption is pretty high. I'm going to get a bit more information about that. And joining me right now to give me that info, I have with me Dr. Joel Yanni, who's a director, radiotherapy and nuclear medicine at Kolebu right here in Accra. Good morning, doctor. Okay, so I saw, just at the beginning, we saw those diagrams there, and we saw some pictures on the neck area of some patients and so forth. I've heard of all sorts of cancers. Until very recently, never heard of necessarily head or neck cancer, because you generally hear about the breast cancer, skin cancer, and so forth. So just to give us some information this morning, what exactly is head and neck cancer?
Thank you for having me here, and good morning to your viewers. Cancers are growths that cannot be controlled, and they start from one part of the body and have the propensity to spread to other parts of the body, particularly to the lung, liver, brain. So that is what cancer is. You distinguish it from benign growths. That's like, let's say, a keloid, for instance. Right? When you have a cut and it heals, you may have accumulation of tissue, and that's a keloid. Keloids are benign. They are growths, all right, but they are not cancerous because they don't spread to other parts of the body. But cancers have that ability. Now we are talking about head and neck cancers. Cancers can occur in any part of the body. There are even cancers related to even the hair roots.
Wow.
Yes. So cancers can affect any part of the body. But today we are talking about cancers involving the head and neck region. So in other words, cancers involving the lip, the oral cavity, the back of the throat, the voice box, and the back of the nose. These are, as a group, we call them cancers of the head and neck region. And if you bring, so we can see the tongue, cancers involving the tongue, the voice box, and then the back of the nose. And then in the mouth, the floor of the mouth, and then the lip. These are cancers of the head and neck region. And unfortunately, it is not talked about.
I was like, what? Head, neck cancer? It's almost like, it's not... Okay, how common is this in Ghana in particular?
So if you rank our cancers, in men, as the commonest is liver, then prostate cancer, then cancers involving the glands, we call them lymphomas. Then comes head and neck cancers. But in women, breast, cervical cancers, cancers involving the genitourinary tract, lymphomas, then the head and neck cancers. But when you come to Kolebu, the radiotherapy centers, in men, head and neck cancer is the second commonest cancer after prostate cancer.
Wow,
so
that's quite high.
Yes, it is quite common. Yes.
Okay, is it even diagnosed? What are the symptoms? Is there like symptoms that one may have in order for them to come and get themselves screened and checked out?
Yeah. So as a group, the presentation will obviously depend on the location. If it is a cancer involving the voice box, it will present with hoarseness of voice. Your voice will become husky. If it's a cancer involving the back of the throat, you may present with bleeding from the nose and headaches, right? If it's cancers involving the oral cavity, it will present with problems with speech. Your speech may change. It may become muffled, not like the voice box started to be hoarse. And then, swallowing is also related to the head and neck region. So you may have problems with swallowing, problems with speech. But before these occur, then it means that it is quite advanced.
So that's at the later stage.
Yes.
You said something about hoarse voice, and I got very scared because my voice is pretty hoarse. I've had it for a while. Most people think I have a voice for radio. Should I be worried?
Yes.
Hey, Doctor, you're going to scare me this morning. Okay, because I have a general.
Let me give you a more comprehensive answer.
Mm-hmm.
You see, for most of the symptoms of cancer, there are several causes. Mm-hmm. So it's up to your general practitioner to decipher what.
So always see a doctor. Don't self-diagnose.
Always see a doctor, right? Because it's an upper respiratory tract infection. For a short time, may give you a hoarse voice. It doesn't mean that you have a cancer.
Okay,
right?
okay.
But chronic hoarseness of voice is something that you want to be serious about.
Okay.
And also your history of risk factors. Right? There are risk factors related to these cancers. So a doctor will be able to distinguish between what is serious and what is not serious. In addition to what I've already mentioned, they can present with growths on the neck, swelling on the neck.
We saw a picture on there.
Yes,
I think
that's also a common presentation. Yes, so swellings in the neck, bleeding from the nose, problems with swallowing, hoarseness of voice, something
and so
that
definitely get it checked out.
Yeah.
So when a patient does go to the hospital, what sort of diagnosis methods is used in order to diagnose that this is indeed neck and head cancers?
Yeah, so the doctor will first of all, your age. Some cancers are more common in particular age groups, right? So your age and then the associated risk factors. The doctors will ask you about this from the history, and then you examine the consistency, the location of any lesion that is found, and then take a biopsy. See, when they take a biopsy to be looked at by the pathologist, and the pathologist will tell us whether it's a cancer or not. Then, of course, when the cancer is diagnosed, you seek appropriate treatment. But the thing with us is that I think culturally, there's a problem with neck swellings. People think that when you have
common. I've seen a few people with it actually. I was going to talk about that.
Yeah. Well, not all neck swellings are cancers.
Okay.
Right. So it's up to you to present to a doctor to find out what it is. But I think we have a notion that when you have a neck cancer or a neck swelling, it is not managed in the hospital, and I think that is not it's not true. We think that neck swelling shouldn't be managed in a hospital. So people would rather go to our native doctors, our herbalists for management. But that is not true. Yeah. Neck swellings can be managed in hospitals. Yeah. And it doesn't mean that when you come to hospital, of course, you die. No, we manage them well.
It can be managed. Okay, we'll talk about treatment in a bit. But apart from tobacco and alcohol, what other risk factors are there?
Infections.
Okay.
There's an infection that will present like an ordinary cold, right? But it may be due to a virus we call Epstein-Barr virus. And when you are infected with that virus, it may take several years for you to develop a cancer involving the back of the throat. We call it nasopharyngeal cancer, and it is quite common. I've seen cases as young as 8 years. Yeah. Even though, as a general statement, cancers involving the head and neck, the incidence increases with age. But children as young as 8 years can have cancers involving the head and neck, particularly cancer of the nasopharynx, and will present as a swelling, neck swelling, and then bleeding from the nose. The infection, another cancer that is becoming more and more common, is cancers involving the oropharyngeal region, that is the back of the throat. In the past, it was mainly related to smoking and alcohol consumption. But lately, because of the practice of all forms of sexual
sex?
activities, yes.
Yeah,
oral sex.
Oral sex, does it have a link with throat cancer?
Exactly, because there is a virus that has been implicated as a cause for cervical cancer. Okay, so it is called the human papilloma virus, right? So when you engage in oral sex, and the virus is transmitted from the genitals to the back of the throat, we have some glands at the back of the throat. We call them tonsils. Okay, they can grow there and cause you cancers
in the long run, like
involving
throat cancer.
Yes, the tonsils.
Okay.
So the epidemiology of oropharyngeal cancer is changing because more and more people are adopting oral sex.
Yeah.
The cause due to smoking is now going down, and then cause due to oral sex is rising, and for that it doesn't discriminate between sexes, because more men smoke. You find that typically cancers involving the back of the throat caused by smoking will occur at in the 50s, 60s, 70s in a typical male smoker. But then now we are having cancers involving the back of the throat that is occurring in men and women, and at a relatively younger age, 40s, 50s, 30s. Right?
Okay.
Yes.
All right. What if you, for like the throat cancer, for example, what if somebody has their tonsils removed? Can they still get the throat cancer, like you mentioned, whether through oral sex way or through like the smoking?
It can still occur.
So even if you have your tonsils removed?
Yes, it can still occur.
Is there a link with the neck cancer and the throat cancer at all?
Oh, the throat is part. I mean, the throat is inside, so it's part of the neck. Yeah. So these risk factors are common to all of them, and then the voice change too. I think, as we mentioned, if you have chronic change of voice in a smoker, you should be taken seriously. So smoking doesn't only cause lung cancer; it causes cancers of almost every part of the body, but particularly lung and then head and neck cancers.
Okay, is it a deadly cancer? Like if you're diagnosed with neck and head cancer, does it usually mean a death sentence?
Not really. It depends on the stage at which. By stage, I mean the extent of the disease at presentation. If it's early disease, it can be managed successfully, but if it's locally advanced, then sometimes it becomes inoperable, and then it's not amenable to treatment with either surgery or radiotherapy as well. The management, we may use all the modalities that we use in cancer management. We may use surgery, we may use
radiotherapy. So this is the treatment. Okay, so we have radiotherapy,
chemotherapy, and surgery, depending upon which site. Right?
Okay, so I saw the picture on there where you had the bumps all over the neck. So with a situation like that, when they have growth, is it a surgery or is it more radiotherapy or chemotherapy?
Yeah, so it depends upon where it's coming from. When you have a neck swelling and a diagnosis is a cancer, we'll do what we call endoscopy and an endoscopic examination of the oropharynx and the oral cavity, and we'll find out where the swelling is. Usually it's not starting from the neck, it's coming from elsewhere within the pharynx, right? So if it's coming from the back of the nose, and then the treatment is usually radiotherapy combined with chemotherapy.
Okay. Since the risk factors are, as we're hearing, mostly like alcohol, smoking, maybe an infection, is it avoidable if you change
the power of the risk factor to recede? So if you stop smoking for, let's say, like 15 to 20 years, then you reduce the risk almost down to zero, right? But if you stop for just 5 years, you are still at risk of developing the cancer. So the lifestyle changes may help you,
in the long
avoid.
run.
Yes.
Okay, almost out of time on this, but just before this topic, we were talking about marijuana, and a lot of people think whether it should be legal or not. But taking that aside, we mentioned the risk factors here being tobacco in particular and alcohol. Is marijuana, smoking, also a risk factor in neck and head cancer?
It is.
Okay.
Any form of inhalation, even fumes. Yeah, fumes, chronic. You see, anything that will cause chronic irritation, apart from the chemical components, the chronic irritation by itself can give you a cancer. And so the fumes can cause cancer at the back of the throat. Studies have been done mostly with tobacco smoking. Yeah, but marijuana is also a risk factor. Yeah.
Okay.
Just that we haven't had many studies on
that.
Yeah.
All right, so thank you for that bit of information. And if anybody sort of has some of the symptoms as we talked about, ideally they should see their doctor.
Yes.
Okay, brilliant. I want to say a big thank you to Dr. Joel Yanni, Director of Radiotherapy and Nuclear Medicine at Korle Bu. And we've been discussing head and neck cancers. Of course, our health segment is brought to you by Lipton Tea, inspiration flowing from nature. Make sure you don't go anywhere because we have more coming up